And you guys know me, I love anatomy and physiology. I would love to chat with you about any of this. So, and I really have all the time in the world right now. So if anybody would like to do that, then we can chat a little bit about how I can chat with you later. We'll do some meet and greets next week or later on this week. So let's get into it. Sorry, flip the slide. Thank you. Okay, so here we are, talking a little bit about what sleep is. So if we're gonna understand if we're not having a good night's sleep, we wanna first understand what exactly it is and why we need it. So some of us may have heard of terms like, for example, REM and the non-REM, NREM, and this stands for rapid eye movement, but it dictates our sleep cycles. So if we look down here in the graph, you can see at the bottom, 11 to 7 a.m. is just a suggestion. But when people say, you know, I only need 4 hours sleep in a night or so, I don't know that that really makes the most sense, and you're gonna understand why. Realistically, as an adult, we likely need somewhere between 7 to 10 hours sleep, depending on a few factors like our age, also like our activity level throughout the day. So it's gonna be completely dependent on the individual, but around that amount of time, because we have to go through several sleep cycles. So that's what the graph that we're looking at right now. I'm getting excited, so clearly now I'm warm. So this is how much I love physiology and anatomy. It just makes me very excited. So here we are. First cycle, if we look at that, they're about 90 minutes in length. And what happens is when we're wide awake, our brainwave patterns are very fast. So we're having a conversation with someone, like right now, hopefully you're super engaged in what I'm saying. So our brainwave patterns are really happy and they're really vibrant, right? So we have fast brainwave patterns. And as we're preparing to fall asleep, our brainwave patterns slowly start to slow down right into a deep delta theta wave. So really, really deep. When we're in a deep brainwave pattern, our brain and our stimulation really shuts off. So if someone's maybe they're calling our name, or you hear noises outside of your room and you may not even perceive them. You actually will not likely perceive them if you're in the deepest level of sleep. So you'll see on the left-hand side that column that shows a non-REM stage 3. So way down there, really brainwave patterns, you're not going to necessarily be able to perceive that. Yes, thank you so much. I love that I have an assistant that's using her mouse there. But anyhow, so you're likely not going to be able to perceive outside stimuli. Every stage of our REM cycle is very important. So even if if you look at the top here, we're in higher paced brainwave patterns. So you're easily woken up when you're in the higher stages, like the non-REM stage 1 and the REM sleep. You're easily woken up. In the very, very deep ones, you're not necessarily. So what happens overnight? Well, our immune system, we all talk a little bit about our immune system right now. Just getting a message saying, oh, Jocelyn, that's your mouse. Thank you, Jocelyn. Yes, and what happens overnight is our immune system will reboot. So when we're sleeping, our brain activity shuts down. It gives our brain a little bit of a chance, and our entire body a chance to clean itself. So your cerebral spinous fluid that flows through our brain, it actually helps to, it's like a toothbrush. It cleans out your nervous system, which is really good. Because something really interesting that I found out through studying is that your brain activity creates a byproduct called beta amyloid. And funny enough, beta amyloid is correlated to dementia and Alzheimer's. Patients that have Alzheimer's and dementia tend to have excessive amounts of beta amyloid in their brain. And what happens overnight is that beta amyloid is cleaned as well as a lot of other toxins are cleaned, and byproducts of wake cycle are cleaned out of your system. Your nervous system is regenerated. Your memories are consolidated, and your immune system is rebooted. So that's why we need a really good night's sleep. And I guess you could all attest likely to what it feels like to not have a good night's sleep, and also to knowing what it feels like to have a really good night's sleep. So we'll move on to the next slide. I feel like I could easily talk way longer than 10 minutes, so I'm gonna ramp it up a bit. But I wanted to talk to you a little bit about what it is to fall asleep and to stay asleep. So this is really important. We're just gonna breeze over this. So it's a very dynamic slide here, but this is called your circadian rhythm. So what happens to our bodies throughout the day, our processes, our body's ability to walk around and move around, and breathing and cardiovascular, and if you're a female, your menstrual cycles, everything happens on a schedule that we don't have control over. Our body just knows how to do it. So for example, if we're going to fall asleep, our body, if you look here at the beginning of the curve of this diagram, we see that when we wake up first thing in the morning, let's just say we wake up around 6, our cortisol, which is a hormone that helps our body to do active things throughout the day, cortisol releases, and then in the evening, it stops. So we can see, hey, around like, I guess 21 o'clock, over 9 o'clock, down here, melatonin secretion starts. So cortisol will start, it'll keep us super active throughout the day, and then melatonin starts in the evening and it helps us sleep. And then cortisol starts and then melatonin starts. So they stop, start, stop, start, stop, start throughout the day to help us into a sleep and awake cycle. So this is really interesting, and I wanted to point this out. Starbucks is super busy around 4 or 5 o'clock in the afternoon, or maybe around 2 or 3, because it helps to keep us awake. We need these little boosts of cortisol to keep our bodies functional and awake. So if we're having trouble with our falling asleep and staying asleep, we may want to observe what normal looks like, which is this circle here, so our circadian rhythm. Understanding that cortisol production happens throughout the day, but it trickles off in the afternoon into the evening, and melatonin starts and allows us to sleep. If we mess with that by giving ourselves stimulation throughout the later afternoon into the evening, then it's going to make us stay awake. So that might be one of the contributing factors that I might have you observe. So we'll flip over to the next slide. The next thing to really point out, this is, I love this diagram, I love it so much, but this one here, it's talking about our circadian clock. So something else that our body does to help to release cortisol and melatonin, to know when this happens, our body perceives light. So it's very highly sensitive to light. So in that diagram here, you can see if light is perceived by the eye, behind the eyeballs, back into the brain, there's a little nucleus called your SCM, your superior chiasmatic nucleus. You don't have a test, don't worry, you don't have to remember this. But that little nucleus back there, it perceives when there's light and when it's dark. So if it perceives light, it says, hey brain, send out some cortisol. And if it perceives dark, it says, hey brain, it's nighttime, we can start up the melatonin. So something else really interesting to know is that your phones or your laptops or your TVs actually emit blue light. And that little nuclei that's located in the brain there, it actually highly responds to blue light. So you're trying to fall asleep and you're just like, I'm so tired, and then you grab your phone and you check your phone and then you move on. It's potentially stimulating that nuclei, which in turn is stimulating the brain to produce cortisol. So you might actually be inhibiting your own sleep by using some of these devices. So one of the things I wanted to mention to you too is this amazing book. Where did I put it? Amazing book that was referred actually by a physician that we used to work with, and it's called No More Sleepless Nights. If you're interested in this book, fire me off an email, because this book actually will help you to create a sleep pattern. So something, if you're having a hard time falling asleep, we spoke to caffeine, we spoke to light, we spoke to the idea of certain stimulations keeping us awake. If this is you, you may need to rejig your game plan when it comes to how you're preparing yourself to fall asleep. That book gets really into it. I see I'm talking, of course, way too long. So we'll flip on to the next slide. Someone asked for the name of the author. The author is Peter Hari and Shirley Lind. Those are the authors, but please feel free to email me and I'll flip you all the info on that book. Okay, so I know a whole bunch of people are really interested in teeth grinding and snoring, because so many of my patients suffer with both teeth grinding, jaw clenching, and snoring. So teeth grinding, there are multiple reasons, and a couple of them are really interesting, maybe things we didn't think about, so I wanted to touch on them. But teeth grinding, okay, so we've likely heard, if you suffer with teeth grinding, what this is your jaw is usually clenched, and then throughout the night, your jaw is shifting, it's grinding, it creates sometimes a noise, but you'll wake up in the morning with a really tight jaw. And you also just might clench your jaw overnight. And also waking up with a really tight jaw may also perpetuate some pre-existing TMJ, with your temporal mandibular joint dysfunction, where your jaw doesn't line up necessarily. This can be caused by a few factors. A couple of them are stress and anxiety. So we have something called a psychosomatic response. So what happens is when we perceive, say for example, we're at work and we have like a fast-paced job and a high-stress one, we got to get things done throughout the day. We might be perceiving a lot of stuff coming at us. We have to get the stuff, we have to man up, we have to get it done. We tend to want to crunch our shoulders and we tend to want to contract our jaw. So that is called a psychosomatic response, is your brain's perception of a stimulation, which in turn creates a somatic reaction. Does that make sense? I can't even see you nodding or not nodding, but I'm gonna hope that makes sense. So when you perceive stress, right, outside force, you're perceiving stress, we tend to clench. If you carry that stress, that psychosomatic response throughout the day, then that will perpetuate the teeth grinding, the tension into the evening. Again, why our yoga sequence is going to hopefully be very helpful for you. Something you can do to down regulate before you go to bed. So your jaw also. So here's the other reason, sorry, why your teeth grinding is sometimes what'll happen is your brain will perceive that it's not receiving enough oxygen. So we'll look at it from a psychosomatic response, stress and tension, and then we'll look at it from a physiological, functional anatomy perspective. If your brain perceives that you're not getting enough oxygen, it's going to send some messages to some mechanisms that can help to cooperate to create a better air channel. So what'll happen is you'll tense your jaw to help to keep your airway open. So just envision yourself laying on your back. We get into the REM cycles, we start to fall asleep, all of our muscles start to relax, all of the tissue relaxes, and then before you know it, you're either snoring or your jaw is starting to clench. And why that is because all of the tissue is dropping back onto your airway, and it's allowing for some, not obstruction necessarily, but limited passage of air, which is highly triggering for that thought process in the brain. So jaw tenses up, can't get enough air in. That might be one of the reasons. So your sleep position might have a lot to do with why your jaw is so clenched as well. Correlating that to snoring. Snoring is the same idea. So say again, we're on our back. We know for those of us who snore, have a partner or know someone who does snore, then likely they're on their back when they're snoring the loudest. And that again is because all of that tissue is just relaxing back onto the airway. And we're literally trying to create a better airway channel. So often snoring is correlated to oxygen disruption. And that might be one of them too. So without getting too much into all of these, I would love, as I said, to talk forever, but now I've been on 15 minutes talking about this. So we will move on to our yoga. So we can let that slide go. Now, what I want us to think about when we start in with our yoga sequence, that this was a really old modality of medicine. So yoga is about a 5,000-year-old practice. And what it was designed to do was to take a look for you, to be your own therapist basically, and to take a look at your body and determine, where do you feel restriction? Where do you feel like you need a little bit more balance? So this is the type of thing I'd like us to focus on today as we move through our practice. So where specifically do you feel that you need to have a little bit more space, a little bit more movement? Where do you maybe feel some disruption? And we're going to connect all of that to our breath. And then what I'll encourage us also to do as we're moving through the sequence is feel where we feel these inhibitions or these lack of range of motion regions in our body. And we might want to compile them into a bit of a sequence that we can create for ourselves into the evening. So you're welcome to reuse this one. As I said, I think Sapna's recording this and she'll have it posted for us somewhere. So you're more than welcome for this one. Or if there's something you'd like to freestyle and do your own thing, then grab some of these that felt good for you and we'll move on from there. But my biggest suggestion would be is that we find a way to down regulate. So put away our computers, put away our TVs, put away our cell phones, and we're going to down regulate our systems before we go to bed. So we're going to prepare our bodies to go into these deeper brainwave patterns. So we're kind of setting ourselves up for success in that way. And we're going to stay away from coffee. I actually have a coffee going right now, so I can't say much about the love for coffee because that's me. Anyway, okay guys, so what you're going to need for this practice is you're going to need a block. So one of these. If you don't have a block, then you're welcome to grab an anatomy book. I had this last time, I made this joke, same joke as last time, I know, but grab an anatomy book. I have tons of those sitting around. And again, I made the same joke, but if you're a lawyer or you're an accountant, you probably have some books sitting around. If you don't have those types of books, just grab some books or grab something that's a couple soup cans. That might be uncomfortable, but something that's gonna leverage you a little bit up off the mat. So I'm gonna position this so you guys will be able to see me and hear me. And if you can't hear me, because I'm gonna have to back up a little bit, then fire me off a quick thumbs up or thumbs down. All right. Once you guys have your blocks, let's come into a comfortable seat. All righty. So we're going to create a nice long spine. Can you guys hear and see okay? So nice long spine. Good, and we're gonna take a few seconds to just allow our sit bones to melt down into the mat. So create a nice long spine. We're gonna take our palms, we're gonna face them towards the ceiling. So palms towards the ceiling, and from the base of our spine, let's just envision our sit bones rooting down into the table, down into the mat, down into the block. Nice long spine. And envision from the base of our spine like we're creating space, each vertebrae, one after the other, creating space, long spine. We're gonna envision like we're a puppet on a string. So someone's pulling on a string through the top of your head, creating as much length and space as they can. And then we're gonna tuck our chin slightly. Good, and from here, just gonna take a few grounding breaths. So take a nice big breath in and exhale. Good, big breath in and exhale. I know this is 10:30 in the morning here in Ontario, and I have a couple friends tuning in from Bali actually, so they're about to go to bed, so this is perfect timing for them, but for the rest of us here, it's a 10:30 a.m. practice, so maybe we'll use this practice to set our intention for the day as a nice calm and relaxed day. And if we're preparing for bed, let's in turn set an intention that we are going to release any tension that we're holding on to for the day, and we'll come back to it tomorrow. And our intention is to tune into our body, release what we're holding on to, and be present to what balance feels like. Good. Nice long spine. As we inhale this time, take a nice big breath into our bellies. Allow your ribs to expand. And as we exhale, we're going to exhale ribs first and then our belly. So inhale, belly first, then ribs. Good. And exhale, ribs first and then our belly. Good. We're going to take our hands, excuse me, Riley. We're going to take our hands and we're going to put our hands just on our lower ribs. So we're going to take a nice big breath in, right into our lower ribs. Feel in your lower ribs as your breath expands. So belly first, then ribs. And as we exhale, ribs, then belly. So that's a diaphragmatic breath. So let's do a few more of those on our own time. Inhale, belly, then ribs. Exhale, ribs, then belly. Good. Take a couple more deep breaths. Good. On the next inhalation with a nice long spine. So again, creating that intention of a length in our spine, then we're going to drop our heads forward. So tucking our chin forward and let your head fall forward. You know, the last one I did, I mentioned I'd do a little bit more on jaw. So we're going to spend a little more time on our upper neck and jaw today. So dropping that head forward. Good, and just feel, how does that tension feel? What if we turn our heads towards the right? So we're going to dropping our head forward, chin towards, our left shoulder. Dropping our head forward, turning our chin towards our right shoulder. And do we feel tension more so one side to the other? Do we feel that we have more length one side to the other? Good, bring your heads back to neutral, dropping our heads down again, creating that tension and that length. And then we're going to rotate our chin towards our left shoulder. So you should feel length all the way through the right side as we bring our chin towards our left. Dropping our chin down towards our chest and the opposite side. Good. Bring your head all the way back down to neutral. Head, chin forward, and then bring your head back up into neutral. Good. And let's shrug our shoulders up. Shrug them as much as we possibly can and then drop them down. Good, shrugging our shoulders all the way up and then dropping them down. So we're going to start with our right. Let's rotate our right shoulder forward. So do some rotations, creating some space in our shoulders. Good, and we're going to go the opposite way. Good, and we're going to start with our left now. So left shoulder forward, big rotations. And then we're going to switch the other way. So posterior rotations on that left shoulder. Good, nice long spine. We're going to bring our left ear to our left shoulder. So drop our left ear to our left shoulder. And we should feel length all the way through that right side of the neck. These muscles here that pull our jaw up, they shrug our shoulders up. All those somatic reactions I was talking to you about earlier. So we're going to be present to that. We're going to take our right hand and place our right hand. We're going to dome our fingers like this. You can't really see here, but dome our fingers, place our right hand down onto the mat. just your fingertips pressing down. We're gonna press our right shoulder down towards the mat, creating lengthen through the arm and then lengthening through the side of the neck, left ear to our left shoulder. If we feel like we need a little bit more, we're gonna take our fingertips, our left fingertips, and we're gonna place them on the side of the right side of our head. But we're not gonna press down, we're just gonna dust the side of our head just to create some length. So just tapping, good. And lengthen. Take a nice big breath in here, allow your ribs to expand. And exhale. Good. Big breath in. And as we exhale, we're gonna drop our left hand down, bring our right hand to our right knee, bring our head back to neutral. We're gonna shrug our shoulders up. And then exhale, we're gonna drop our shoulders down. One more time, shrug those shoulders up. And then as we exhale, drop our shoulders down. We're gonna switch sides. So we're gonna bring our right shoulder to our right ear, create the length to begin with. So we're gonna isolate that stretch right into these specific muscles on the left side of our neck. So right ear, right shoulder, good. So creating that tension, that elongation. Then we're gonna take our left fingertips and we're gonna place our left fingertips alongside us on the mat. We're gonna dome those fingertips, doming those fingertips down. Okay, good. Nice long spine, right ear, right shoulder. Good. And if we'd like to, we can take our right fingertips, we can place them just to the side of our head there and allow for a little more length, but reminding ourselves it's not about pulling our head down. We're just creating some length, some guidance with our right fingertips. If we consider it guidance, good, big breath. Inhaling back up to neutral, we're gonna shrug our shoulders up and then drop our shoulders down. Shrug our shoulders up and drop our shoulders down. Good. So we're gonna bring our elbows out to the sides like this. So cactus, we look like a cactus. Good, take a nice big breath in, and with that, we're gonna press our chest forward. So this is our sternum here. We're gonna press our sternum forward. Now take a big breath in. And exhale. We're gonna be in this pose for just a moment. Take a nice big breath in, press that sternum forward, and exhale. Good, last breath. Press forward, big breath in, creating as much space as we can. And as we exhale, clap our hands together, drop our head forward and round through the back of our spine. Good, we'll be here for a couple breaths. Big breath in, reach those fingertips forward, dropping that head down, pulling those shoulders down. Good, creating space in through our middle back. Inhaling back up through cactus. Exhaling, hands together, dropping our head forward. Good. Inhaling up through cactus. Exhaling, dropping our head forward, rounding through the spine. Inhaling back up to neutral, we're gonna bring our hands alongside our spine. We're gonna bring our right hand to our left knee, and we're gonna elongate. So the intention here is to create length. So again, envision that puppet on a string, a puppet on a string, strings being pulled right through the top of our head. We're pulling up through the top of our spine, creating as much space and length in our spine as we can. That right hand comes onto our left knee, length and rotate. So rotating, we're gonna bring our gaze over our left shoulder. So we're gonna rotate from the base of our spine. So envision ourselves from the base of the spine, rotating all the way through the crown of the head. So inhale, as you inhale, you're gonna take up space. So inhale, feel yourself taking up the space. As you exhale, you've created space. So see if we can twist even a little bit further. Bringing our mind's eye into the intention. So we don't want to create pain, we want to work with tension. So if we feel tension, we're okay there. If we feel pain, we come back a little bit. Big breath. Good. Last inhale, big, take a deep breath in. And as we exhale all the way back into neutral, let's bring our palms so they're facing towards the ceiling. Good, and let's just take a moment. See how you feel. See if you feel a difference one side to the other. So we're working through our flexion, extension, our side bending, and now we're working on rotation. These are all the motions that our spine does. So we're gonna work through unraveling tension. So as we create that intention, we're gonna take a nice big breath in, creating that long spine to begin with. We're gonna place our right fingertips, we're gonna dome our right fingertips and place them behind us, initiating the twist with the base of our spine, looking over our right shoulder, creating that length. Gaze over our right shoulder. Good. Take a nice big inhale. Allow your body to expand and take up space. And as we exhale, creating more space, seeing if we can take up that space with a little bit more movement. Good. Inhaling back to neutral, palms facing towards the ceiling. Let's see, how does that feel? Take a nice inhale. Exhale everything with a good. Big breath in. And exhale. What makes this yoga for sleep? Well, this sequence, as you continue to breathe, so continue to work through your breath, us taking our mind away from multiple thoughts and into linear thinking is the beginning of us understanding how to change our brain waves. Us feeling where we feel tension or where we collected tension throughout the day is also the way that we're going to help to alleviate tension, bring ourselves into balance, so that we can find ourselves in a space that's going to allow for more calm and thoughtful processing. So nice big long spine. And we're going to go into a forward fold. So if you find your hips a little sore sitting this way, you're welcome to come into a different seated position. So if you'd like to, we can come onto our knees like this. You can come right up your sit bones. You can come onto your heels if you'd like to do it this way. Or if you have that block, this may not work with your book. It would work with your soup cans though. But take your block and you can come into a seat on your block like that. So if you need a little less pressure on the knees, or if you needed to switch it up, feel free. So we're going to create a nice long spine again. And as we inhale, reaching those arms all the way up, take a deep breath in. And as we exhale, we're going to forward fold. So reach with your fingertips nice and slow towards the front of the room. We're going to plant those fingertips down onto the mat, and we're going to drop our head forward. Good. We're going to be here for a few breaths. So take a few deep breaths in. As you inhale, allow your body to take up space. And as you exhale, folding just a little bit further, taking up just a little bit more space if we can. Good. Big breath in. And as we exhale last time, take as much space as we can. See if we can even creep those fingers along the ground to see if we can go just a little bit. Good. Inhaling all the way back up, reaching those fingertips up towards the sky, and exhaling, hands back down onto our knees. Good. We're going to create a little bit of a sequence there. So we're going to start from the beginning, take a nice big breath in and shrug those shoulders up. Exhale, drop those shoulders down. Inhale, rotate our right shoulder forward, rotate our right shoulder backwards. Good. Inhale, rotate our left shoulder forward. Exhale, rotate our left shoulder backwards. Good. Inhale, reach our right arm all the way up, drop our left arm down onto the mat, and we're going to side bend over towards the right, opening up the rib cage all the way through the right hand side. Good. Big breath in, and exhale, side bend just a little bit further. Inhale all the way back up, drop our right hand down, bring our left arm up, take a deep breath in, and as we exhale, side bending towards the right. So checking that our sternum and our body is almost like in front of a pane of glass. So we don't want to fold over, we want to create length in this plane. Good, nice long spine. Inhale, exhale, hands back onto the mat. Inhale, elbows up into cactus. Good, take a deep breath in. And as we exhale, rotate towards the left. Good, inhale, back to neutral. Exhale, rotate towards the right. Inhale, back up to neutral. Good, and as we exhale, we're going to clasp our hands in front of us, dropping our head forward, rounding through the spine. Inhaling all the way back up. Good, into cactus, pressing our sternum forward into a little baby back bend. As we exhale, dropping our hands forward, clasping them, pulling them forward, dropping our head forward, rounding through the spine. Good, inhaling back up to neutral. We're going to bring our hands alongside our sit bones. Good. Okay, we're going to take away our blocks now. We're going to come into cobbler's pose. So you'll see now I have a little bit of a hip injury, so my left hip won't go the way I want it to. So do as I say, not as I do. See how it sticks up like this? I'm working on this, which is really good. Good for body awareness. But the right knee, left knee should be parallel if they can. We're going to bring our toes. I don't know if you guys can see my feet. We're going to bring our toes together like this. If this isn't available to you, feel free to bring your feet further away, like this. The intention here is just opening up through the hips, as well as we're going to take our thumbs and we're going to massage our feet because it feels so good. So thumbs are going to come onto the inside of our feet. We're going to massage all the way through the base of the foot. So just take a second to give yourself a little bit of love, because this is all this is. It's just a little bit of love. So massage those feet out. Any tension that you're feeling, just take a second to release that tension. Good. Now take a nice big inhale, create a nice straight spine. And as we exhale, we're going to forward fold. So you can take your hands, you can clasp them around your feet, you can drop your head forward, and you can forward fold. If you'd like to still be using your block because you need a little bit more leverage here, you're more than welcome to do that too. Whatever you feel comfortable with. So nice long spine, and as you exhale, you're going to forward fold. Good. Releasing any tension that we feel in through the hips. Take a nice big breath in. And as we exhale, we're going to bring our hands back into a dome. We're going to place our hands behind us. We can bring our feet in front of us so our knees are bent. Nice long spine, and we're going to pull our shoulder blades. Shoulder blades are going to come back together. So we're going to open up through our sternum, through the entire front of our chest. So squeezing those shoulder blades back and together, fingertips firmly rooted down onto the ground. Press that sternum forward. Take a deep breath in. Feel how that feels. It opens up all the way through the anterior aspect of your chest. If this is too much because you have a shoulder injury, please feel free to release one side or just go so far as you can. Big breath in and exhale. Now coming back to the jaw, all of this tissue is correlated to your jaw. So we have been working on the jaw the whole time, but we're going to focus now on a muscle that's through the anterior aspect of our neck. But I'm going to challenge you to watch the extension in through the back of your neck as we do this. So squeezing those shoulder blades together, we're going to bring our chin forward, bring our gaze to where the wall meets the ceiling in our room. So just our gaze is slightly forward. Now we're going to tip our chin up, and we're going to press our chin forward. So let me come onto a bit of a different angle here. So elbows together, nice long spine. Bring our gaze towards the top of our room and press your chin up and forward. Now you're going to open your jaw from here. Good. And let's break. Everybody come on out of it for a second. Shake it out. That's a lot of extension through there. We're going to try it again. So squeezing those shoulder blades back and together, fingers onto the mat, press your sternum forward, elongate through the anterior aspect of your neck. So watching extension in the posterior, and our chin and our gaze is towards the top of the room. Now press your chin forward. And relax your jaw. Press again your chin forward. And relax your jaw. Last time. Pressing up, chin forward. Good, and relaxing your jaw. We're going to come on to all fours. So relax the block or anything that's on your mat, you're just going to put it to the side. So we're going to come on to all fours. So we're going to check that our knee is in line with our heel as we come into a table. And then we're going to check that our wrists and our elbows and our shoulders are lined up. So making sure that they're all in a nice straight line. Our toenails are rooted down onto the mat. Good, and from here, just make some circles. So just feel it out. How do you feel to this point? We did a ton of work on your thoracic spine, so your upper back and your middle back. Maybe your lower back needs a little bit more right now. How does your neck feel? Good. So swaying from one side to the other. Good. And from here, what we're going to do is we're going to come into a cow spine. So we have cat-cow. We did it when we were in seated. So it's going to work through flexion extension, but this time we're focusing more on our lumbars. So we're going to tip our tailbone forward, and we're going to create an extension through the lower back like this. So tailbone forward, creating some extension. Our gaze is directly in front of us onto the mat. Good. So create some space. Take a nice big breath in. And as we exhale, we're going to do the opposite. So tuck your tailbone under and try and see if we can create the flexion from our lumbar spine. So this is flexion into our lower back. Good. As we inhale, tipping back through cow. So tipping your tailbone forward, contracting, creating extension through your lumbar back. Good. And as we exhale, dropping our lumbars into flexion, our lower back into flexion, tailbone forward and under. Last time. Inhaling into extension, exhaling into flexion. We're gonna bring our toes together, our knees apart, and then we're gonna drop back into child's pose. So our arms can come all the way out in front of us, or if we're working with a shoulder injury, feel free to bring your arms alongside your body. And let's just take a moment to find some space. So just observe, how did this feel to this point? And just do a little diagnostic. And see if there's any point where you feel like something needs a little more love. Every person creates different patterns. Although we have the same component parts, we all create different patterns based on our experiences through life. So let's honor that and be present to that. So nice big inhale. Good, let's all come back up into seated. Good, I'm gonna have us all flip over onto our backs, and we're gonna do a thread the needle. So what we're gonna do, this is to open up the lateral aspect of our hip. So we're gonna place our right ankle over top of our left knee. So check the ankle bone itself. You can see there's two bones on either side of that ankle. Check that the bone isn't what's on the knee. So you're gonna slide the ankle bone so it's slightly over top of the knee, outside of that space. And then we're just gonna come onto our back. So this might be enough for some people, and that's okay too. But what we're gonna do here is we're gonna pull our left knee in towards our sternum. So this again, where we're feeling this, should be along the lateral aspect of our hip, or wherever you're feeling it. Just be present to that. If you need to put a block, good, to allow for some leverage, you can do that too. So inhaling, and as you inhale and exhale, feel free to rock a little bit. Do you feel the intensity builds as you rotate slightly towards the left? Do you feel the intensity builds as you come back towards the right? Good, make this practice your own. Inhaling back to neutral, plant both feet back down onto the mat, and we're gonna switch sides. So left over top of our right. We can take our left hand if we'd like and press it into the knee. This might be enough for us. And if that is, that's okay too. So take a few deep breaths in here. And as we exhale, allow ourselves to create some space. Good, deep breath in. Allow for our body to expand and work through tension as we exhale. See if we can take up a little bit more space. Good. On the inhale, we're gonna come back up into neutral. Hug both knees in. We'll do just a little bit of a rock from side to side. Good. And then we're gonna cross one foot over the other, and we're gonna slowly rock forward back up into a seated position. So we're gonna have you, if you'd like to grab your block, you're welcome to. Or if you'd like to sit on your knees, you're welcome to do that too. Put your block underneath your sit bones, create a nice long spine. Our last asana is gonna be a spinal twist. So creating that space, that long spine, take a breath in. And as we exhale, bring our right fingers to our left knee, initiate the twist with our lower back, and rotate towards the left. Our gaze, our neck is the last point of rotation. So elongate from the base all the way up through your lumbars, your lower back, all the way through your thoracics, right up into your neck, and then if we can, if it's available to us, left chin, or your chin over your left shoulder. I guess we don't have a left chin, do we? Good, deep breath in, and exhale. Inhale all the way back to neutral, shake it out a little bit, and then we're gonna switch sides. So nice long spine. We're gonna bring our left hand to our right knee. We're gonna bring our right fingertips behind us, create space and lengthen through our lumbar spine, initiate the twist from our lower back, and rotating over top of our right shoulder. Our gaze is the last to rotate, big breath in. And as we exhale, rotating just a little bit further. Good, inhaling all the way back into neutral. Good, so if you'd like, we're gonna end with our 5-minute meditation before our question and answer. So feel free to grab some socks or a sweater if you'd like, and then find yourself in a comfortable seated position. Good. All right. So once we find ourselves in a nice comfortable seat, let's create some space again. Good, nice long spine. Tipping our tailbone forward, contracting through our core, creating length all the way through our sternum, opening up through the ribs. Palms are going to be facing towards the ceiling. Good. So again, how does yoga help with sleep? Well, it creates some space. It's linear thinking first and foremost. and allows us to create some space and releasing tension in areas that might be contributing to some of our sleep dysfunctions. And perhaps we take an opportunity to review what we might want to do when it comes to creating a sleep schedule. So setting ourselves up several hours before we go to sleep for success. So again, please feel free to email me. I love to talk about this, and I'd love to talk to you because I'm bored all day. I don't have the patience to see, so it'd be really nice to do this. So nice long spine, create that space. Let's see if we can continue with a visualization. So closing our eyes. Good. Let's allow ourselves to tune into our toes. Just explore our toes. How do they feel? How does one side feel compared to the other side? Is there any tension in through our toes? And if there is, allow it to release. Good. And let's observe if there's any tension in through the tops of our feet, and through the bottoms of our feet, into our heels and our ankles. How do they feel as they're pressed against the mat, as the ground? And just observe. Any tension that we're holding on to in our feet and through our ankles and our toes, and just allow it to release. In our mind's eye, we're crawling up through our shins and our calves into our knees. How does that feel? Do we feel any tension that needs a little bit of release? Good. Observing through our quads, through our sit bones, through the tops of our legs, right up into the base of our pelvis. If we're holding any tension, allow ourselves to release. Any tension that we're holding on to in our lower backs, and through our abdomen, right up and through our diaphragm, and allow ourselves to release. Tension that we're holding on to through our sternum and our ribs, and our upper back, and allow ourselves to release. Anything that we're holding on to in our neck and our shoulders. Allow ourselves to release. Anything that we're holding on to through our arms, our elbows, right down into our wrists and our fingers. And allow ourselves to release. Any tension that we're holding on to and through the backs of our heads, through our forehead, through our eyebrows, through our eyes, our jaw, our cheeks, the front of our necks, allow it to release. And if we could just envision from the ground, envision each aspect of our body filling up almost like fluid energy, like white, envision white fluid from the base of our feet all the way up through our body. There's no tension. The tension is released. Just envision that white light, that white fluid all the way up through your legs, through your hips, through your abdomen, right up through your sternum, down your shoulders, right into your fingers. All the tension is released. It's all white fluid energy, good. All the way up through the base of our necks, through the tops of our head, through our forehead, our eyebrows, our eyes, and our jaw. There's no tension, just white energy, white light. Good, and we're gonna start to deepen our breaths. Take a nice deep breath in. Anything that we don't need, we're gonna let it all out with a great big good, nice big breath in. And as we exhale, anything that we don't need, we're gonna let it out with the sound of let's shrug our shoulders towards our ears, creating a nice big rotation in through those shoulders, wiggling those toes. And we can open our eyes. Good, bring our palms together. And namaste, guys. Thank you so much. That was so good.
I am pretty sure everyone's feeling extremely relaxed right now. That was awesome. I always feel like after these sessions, we all just need to take a nap. So
yeah,
I'm just gonna tap myself to wake up a little. So we did have a couple of questions, a lot of compliments. So good job, Andrea. That was amazing.
Good.
I guess, okay, so this is a good one. What happens when the adrenals don't produce cortisol effectively with sleep patterns?
Well, that is a fantastic question. So, okay, so we start to look in, if we start to look in at individual sleep type dysfunctions, that's what I was saying to you. It's so general, what we were just talking about, the information we gave in that quick little 10-minute synopsis. But each individual is so different. So there's lots of reasons why we might have adrenal dysfunction. So for example, adrenal fatigue, right? So we think too, okay, what's going on and why is our body, our hormone cycle not regulating? So this is where I'm so happy to work like with a team, like for example at Integra. So I would refer, for example, someone who is working with adrenal function, I might refer to a naturopath. Like we have Shannon, she did a talk last week.
Right.
She does work with this. So I will be looking at blood supply, for example. We know that our adrenals are at the level of T12, and T12 is right here. So this is the base of our spine. So where our lumbars and our thoracics meet one another, functionally, that's where I'm going to want to take a look and say, okay, is there something going on with movement there? Is there too much restriction, too much contraction? An osteopathic manual therapist doesn't look at pathology, so I wouldn't be looking at adrenal dysfunction or a prescribed pathology, but I am looking at how do all the nerves, how is going on with the nerves, the blood supply, the vascular movement, what's going on with all the muscles, what's going on with the bone movement. So that's where I can take a look for sure. If we want to look at adrenal dysfunction, I might refer also to get my friend and my colleague there, Shannon, involved to see if she can help out when it comes to a naturopathic way of looking at things. Maybe a chiropractor would have a different way of looking at it too.
Yeah, for sure. For sure. Lots of questions about cortisol, but I think you've pretty much covered that, which is great. Someone actually has a question about TMJ and dysfunction, and they're just wondering, is it possible to completely alleviate TMJ dysfunction through yoga and physiotherapy, or is it more a matter of decreasing tension, but still being okay with the clicking and dysfunction?
That's a really great question as well. So TMJ, so here's the thing, right? So we have our cranium and we have this is called your maxilla, where your top teeth are here. And then this bone down here that moves, this is called your mandible. So TMJ is temporal. So this is your temporal bone, mandibular, which is the mandible, dysfunction. So this joint creates like a hinge, there's a little joint here. So what's gonna happen? A lot of the muscles that allow me to talk about them right now, they're contracting down through here. So these muscles will pull my jaw down. What'll happen? Let's just say I sit at my computer all day and I'm here with my mouse on my right-hand side and I'm doing all of this and I create a bit of a rotation. Is that these muscles in through my neck on the right-hand side, for example, are gonna start to get really contracted. If they start to get contracted based on a pattern that I'm creating, then some of these muscles on the side of my neck will also get contracted, which may pull my jaw laterally one side versus the other. So as we were moving through yoga, you may have observed, and through some of our yoga sequences, you may have observed more tension one side to the other. Oftentimes these patterns are created all the way through the spine, but right up into the base of the neck. So for example, when I'm treating temporal mandibular joint misalignment, what I'm instead looking at is what's going on with the muscles that are pulling things out of alignment. And that's how we deal with TMJ. So the answer is yes through yoga, yes through physio, also osteopathy. I know that we do a lot of work that go through aligned joint tissue, but then it comes down to you observing what created this to begin with. So if it's a misalignment at your desk, then perhaps we work on creating more alignment at our desk. In which
And
case, the chiropractors right now are right.
Yes, this is a workshop about you and what you do. But yeah, absolutely. And I think you know what, that's exactly it. So like, I mean, right now we're kind of in a obviously weird situation. Like, Andrea, I know you're still, you know, your college has kind of asked you to stop treating during this time altogether, but you know, you are obviously, you through generosity, you've made yourself available for, you know, people to still, you know, book in some complimentary sessions just to kind of answer any questions to help them get by. And for you to maybe even triage if someone's really urgent and can't wait until we reopen, possibly even exploring things like virtual physiotherapy or virtual chiropractic in this situation to help, even just giving them some exercises and maybe some better assessment during this time. Is that something that like people should think about right now if they can't get in to see you? And obviously, like, you know, when can they call you or book a complimentary session to like go over some of this stuff? Because I know some people have a lot of specific questions that are, you know, more unique to their own situation. So like, when can they reach out to you, and when would you kind of advise them to maybe book a virtual rehab appointment through a chiro or physio?
Well, first of all, I miss my patients a lot. You know what it is to be a therapist. So
I know we're struggling.
Yes. So if anybody wants to talk about anything at all like that, I do have hours set up in my schedule, and you can book on Jane on the app that you guys have profiles with. You can book and we can do little 10-minute or 20-minute chats. And I can't treat you obviously, but we can definitely talk a little bit about what's going on with you. I really love yoga, right? This is what I really believe strongly in, us understanding our body's movement. So I do think there's a lot that you can do for yourself. I do also think we can just intuitively take some time to understand the balance that we create in our workspace. And if we need to rejig anything that's going to allow us a little bit more balance. And yes, I do think also, depending on what you're suffering with, I've had a few patients message me, people with neck issues. There is stuff online that some of my colleagues can do to help you too, as they are still allowed to work on more acute cases. So I think it's a patient by patient thing. And I do love how empowering yoga sessions like this are, because it teaches you how to be your own therapist. So please
100%.
me if I didn't answer your question, or you want to talk to me a bit more, especially about physiology. I will talk to you all day about that.
And you know what I love about that, Andrea? You're taking such a half glass full mentality. Like, I think right now, I mean, we can all kind of attest to it. Like, I say right now, the most unique thing for me is just that being able to talk to people right now about, you know, what's going on in their unique situations. Like, when we don't really get to touch on these things because we don't get to see their internal spaces. You know, we don't get to see, you know, how we can kind of like focus on changing just some of the things that are going on in their home as much as we can right now. So I love how much you're using this glass half full mentality of, you know, using yoga, empowering people to be their own therapist. I think it's so important. And I think these are things that we all try and strive to do so much, but when we're all at work and commuting, like, we don't have time for this. But now everyone kind of is finding time for this and realizing that, you know what, we'll guide you, but you know, the answers are within yourself, and we'll kind of help you find those answers. So thank you. I think that's awesome. Now, I know there's a couple more slides, Jocelyn, just kind of helping people navigate to find Andrea. So if you just notice, like Andrea mentioned, we have a virtual platform. A lot of you are already patients of ours, but if you haven't been onto the allied health side, we do have online booking. So you can kind of go on here. You'll see Andrea's beautiful face right here at the bottom. If you click on her, you'll see that she's offering complimentary. We just call them meet and greets. If you're already an existing patient of hers, you can still book that too, and she'll be able to kind of check in with you virtually and see you. So if you want to show her something, if you want to like have her watch you move, you know, that is something, like I said, maybe that's an option for you. And other services are listed on here too. So, you know, we just want to make sure you get the right education and the right help that you need. And yeah, and like, if you're just bored and want to talk to her, she's around. We're all around. So definitely take use of us. And I think honestly, Andrea's webinars have been extremely popular just for the fact that you're helping all of us move, and we're all feeling a lot more mobile. So thank you. And for all of you too who are looking for anything else, we have an at-home hip assessment and treatment workshop. I know Andrea just mentioned she has a bit of a bummy hip. So like a lot of us, you know, tomorrow's assessment webinar will be awesome. And we have a doc with a great special interest in sports med also joining us, Dr. Braden Gravel. We also have a really fun one on Thursday with Sarah Hall. She's our pelvic floor physiotherapist, and she's going to be joined by a female family doctor, Dr. Pastricia, as well as our male doctor, Dr. Stefan Kegel, who will be touching on the importance of Kegels, as well as talking about male pelvic health. So it's going to be an awesome one. Sorry, the hip assessment webinar tomorrow is at 3 p.m. That was a typo, but we did change it. So all the announcements on this registration will say 3 o'clock. So that's our bad. Sorry about that. But yeah, keep joining us. We still have a lot more content coming at you. We're working on next week's content calendar right now. So if you have ideas, shoot them our way. We always like the inspiration if there's something that you're looking for. And just stay in touch with us. If you still need to see a medical doctor too, we've got lots of virtual telephone appointments with our medical doctors too. And they're also here to guide you. And they completely 100% believe in a collaborative, integrated approach too, which is why a lot of them are jumping on these webinars too, to help educate you. So yeah, if you have any other questions, you know where to reach us. We're open virtually for you all day, every day. And until tomorrow, enjoy the rest of your day, guys. Thank you. Thank you so much, Andrea. That was amazing.
Awesome.
Okay, bye.